Welcome to this quick oral presentation about the Scottish Brain Health Register, which has been developed by Edinburgh Dementia Prevention researchers based at the University of Edinburgh in Scotland. This has been developed really from a need for better quality data about people living with a diagnosis of dementia. Healthcare records will contain some of the data that we're interested in, and we use this information for two broad purposes. The first would be pre-screening, to see who is eligible to take part in clinical trials. And from a more macroscopic or population-based level, we're interested in the characteristics of the population of people in Scotland living with a diagnosis of dementia. So for the sake of example, understanding how many people in Scotland are currently receiving donepezil for their dementia would be interesting. The problem is that these data are recorded to varying levels of quality, and they also tend to be represented across fragmented systems. So different care teams, different health boards, different aspects of care provision will record this data when really we would like it all to be in one place and recorded to the same standard. We're also missing a trick as researchers and as clinicians. We could be using this information to help provide personalized prevention plans for the individual. So this is the idea of SBHR. We want to have research at the heart and center of clinical care. We want to integrate these two previously separate realms of activity. The idea being that if somebody, i.e. somebody with a diagnosis of dementia, takes part in a research protocol, they will generate more information about themselves which previously did not exist. And that information will be of benefit to the researcher who is looking to record that data, the clinician who could make use of it, and also the patient and participant who stands to benefit from their care that they receive from the clinician. An example of a research protocol run through SBHR would be a protocol for new ApoE testing, the development or piloting of a digital neuropsychological test, or also machine learning algorithms. So for example, in Edinburgh, we have had success with a MRI segmentation algorithm, which is making use of routinely collected clinical data. And the idea of SBHR feeds on this feedback loop of research. So a researcher has a protocol which they are interested in running. Again, let's say they're developing a neuropsychological test. They would take this to the SBHR committee who review the application, review the protocol, try to see what the benefits and the risks are for the participants or the patients, and also how the clinical care team could stand to benefit from it, in addition to what the researcher is hoping to gain. If it's approved, this is a protocol which is distributed and discussed in the clinic, either through consultant or nursing teams. It leads to participation, i.e. patients take part in the protocol. That generates data which is of benefit to the researcher because they're conducting their study. They get to validate their test, for example. And it's also a benefit to people in the clinic. So they stand to gain information that previously they wouldn't have had access to had the protocol not been run within the clinic. And this is ultimately the ethos of the Brain Health Clinic. Brain health clinics are hoping to promote the idea of brain health and dementia as a preventative condition. But as a big part of that, they want to be able to collect data about people so that they can better understand the person that they're caring for, understand their exact risk, and as a result, produce personalized prevention care plans for people, understanding their risk, understanding what makes them at risk and what could be done to mitigate that. But then also, by following a sort of protocol-led method of data collection, we're ensuring that data which could be beneficial are collected to the same standard across different brain health clinics. The idea being that as brain health clinics are distributed and spread across other sites in Scotland, you then have lots of different patient populations who are going through these research protocols, generating data about themselves. And as a population of people living with dementia in Scotland, we're in a much more stable position to do sophisticated disease modeling about people with this condition. And ultimately, this comes from a change in practice and understanding of how research can benefit people in clinical environments. And we have a presentation on this point, another point in the conference. So thank you for listening and hope to see you there.